Welcome to episode 75 of Chairside Live. Megan, how do you feel today?
I'm not here.
Neither am I. We are both gone.
Ooh.
We are taking off a little bit of time, our traditional post-Halloween vacation that we take together to go survey pumpkins of the world. No, actually, I'm going fishing, and therefore we decided not to do an episode this week, but the viewer is the real winner. It's a win-win. It's win-win-win. Win for me, I'm on vacation. Win for you, you don't have to write any news. And win for the viewer, because they get to see a special excerpt from a special DVD. One of my dreams came true this year when Gordon Christensen called me and asked me to come up to Provo and make one of his famous PCC DVDs with him on snoring and sleep apnea. And I was thrilled to do it and went up there, and we had an opportunity to make this introduction to snoring and sleep apnea. I'm going to highly suggest you purchase this DVD if you're not currently treating these patients. And if you say, well, I don't have any patients who snore or who have sleep apnea in my practice, I'm here to tell you that's just not true. And the way I identified these patients, I added one question to my health history. So when patients would come in and update it, it was a question that said, are you interested in a non-surgical way to stop your spouse from snoring?
Yes.
And so, yeah, I know you are, because we've made your husband an appliance.
Yes.
And the truth is, for every 10 women who see that and fill it out, literally 7 or 8 of them will put, yes, I'm interested in a non-surgical way. And the other 2 or 3 put, I don't care if it's a surgical way. I don't care what you have to do. You can even lop his head off if that's going to work. Whatever works and whatever stops it. And so I did it originally just to see what the interest was and to kind of get on the good side of the women in the practice. But as it turns out, it helps not only the women, but it helps the men too. Men who are, driving to work and falling asleep, driving home and falling asleep, they're just always in a bad mood because they've never slept through the night for the last 15 years. And for some of these guys, when you're able to address their sleep apnea, they start sleeping through the night, and they'll tell you, this is the first time I felt good in the last 15 years. I forgot what it was like to feel good because I felt cruddy for so long. I've seen men in tears. I've gotten hugs from men. If you're uncomfortable getting hugs from men, you may not want to incorporate this into your practice because a lot of the time it is men that we're dealing with, and a few women as well, but predominantly it's men that we treat. So it's a very rewarding part of a dental practice. It's one of these areas that slips between medicine and dentistry where nobody's really taking care of it. And as much as we love our Oprah moments in dentistry, when you put new veneers on someone and you show them the mirror and they tear up and they start to cry like it was extreme makeover, you're going to find that happens a lot more with sleep apnea. These are patients who not only look better, the circles under their eyes go away, things start to clear up in their face and they just look different, but they feel fantastic. And that's really one of the greatest gifts that we can give any patient. And so when I went up there and made this DVD with Gordon, since as a laboratory, we make so many of these appliances. In fact, we make over 25,000 just silent night appliances a year. And so I want dentists to get a feeling of, hey, there's a lot of dentists doing this that make up for those 25,000 plus appliances that we do. So I'm going to suggest that you go ahead and order this DVD. I'll have James put the information right down here on the monitor. Thank you, Megan.
You're welcome.
And this is something you want to get involved with. It's easy dentistry I call it thinking man's dentistry, and I don't want to blow it up too much, but it's an area of dentistry where you don't have to give somebody a shot. You don't have to use a handpiece and drill on their tooth. So if your back's starting to go bad, it's just a nice way to be able to do it. You get good reimbursement through medical insurance for these appliances. And really, it's just a great way to get on the side of women who want their spouses to stop snoring, and of the men who have sleep apnea and go a step beyond that and really help them to feel better. So Gordon and I had the opportunity to do this DVD, and one of the things that we spent a lot of time talking about was appliances, because in addition to the 4 or 5 that we make here, there's probably over 100 appliances available worldwide. So we looked at the most common ones, and that's what this episode of Chairside Live is going to be for you today. That excerpt from the DVD. I hope it whets your appetite. I hope it gets you excited to start treating these patients, and I hope it gets you excited enough to order the DVD, take a little deeper dive into snoring and sleep apnea, and see it. This is a part of dentistry that you'd like to get involved with. Well, Gordon, I've decided to bring, believe it or not, a small sample of the appliances that are available, but it's pretty obvious why this would be intimidating to the average dentist, right?
Totally confusing because they all do about the same thing.
They do, and so really this is like, Coke and Pepsi and Shasta.
Right.
These are all different flavors of essentially the same thing, but there's, little differences between some of them, and so it's kind of worth pointing out what they are, but I don't want any of the dentists to look at this and think to themselves, do I really need to know everything about all of these? I don't know anybody who uses all of them.
There's no way. Every one of them is the best. It's like products we evaluate. Everyone is the best. Well, let's get going.
All right. Well, that first one you're about to pick up is the Way Appliance, and like most of them, this allows 10 to 11 millimeters of advancement. You can see we've got the hardware in the palette, but if you try to open those two apart, you'll see they really don't come very far apart. So that's one of those ones for a patient with a BFT, with a big fat tongue, that's going to make them feel claustrophobic. They're not going to like that. It's thermoplastic on the inside, so this can be heated up, put into hot water. Patient puts it in their mouth and bites into it, which is nice.
But it's a major mouthful. I can't imagine having that big of a thing in the mouth.
You put it in if you like, but
I'm not going to put it in.
The Canadian government has tested that a lot, and it's got a 78% success rate. So it does work, again, if people wear it.
Okay.
This is an EMA appliance. This is look like you could wear that in your mouth, probably.
Absolutely.
A little
now
more simple.
that one's small.
Yep.
Easily adapted, I can see.
Easy to titrate. You can actually send, you'll notice there's a bag of bands of different durometers and different lengths. So this is one where the patient's not coming back to the office for adjustments. If they continue to snore, they put different length arms, shorter and shorter arms on. So they can titrate it themselves at home till their partner reports that they're no longer making any noise.
That's highly desirable for someone living a long ways away.
Exactly, and you can see that would probably be its low profile, probably a good starter device to get somebody used to appliances.
Right on.
This is the Herbst. It's been used as a functional appliance for a long time in orthodontics, and it was realized that, wait, we can move the mandible forward as well, like we were in these Class 2 patients. And you can probably see that it's pretty strong. These are pretty good connectors, but even some really strong bruxers can break those screws off of there. And if you go to open that one to see how much the patient can open, they can open wide. So that's a very comfortable appliance. They can open wide, they can yawn, but the problem is, in some patients, when they're sleeping, their mouth will fall open because it has so much freedom, and that's why you can put vertical elastics here to keep their mouth
and
closed.
There's so much hardware on the side. I can see a side sleeper would feel like they had a barbed wire in their cheek.
Absolutely. Yep. Like everybody feels when they get ortho bands on for the first time.
Right on.
That is a TAP Elite. TAP is one of the premier OSA appliances, been around for a long time, 3 or 4 different versions of it. Probably the most tested, if you look at the research, the most tested device that we have out there. So lined typically with thermacryl on the inside, so again, it can be heated up in water and put into the patient's mouth, which is nice in case they have a composite done. Some of the hard acrylic ones won't fit back in place. You can heat these up, put it in. It fits very tight. It adapts because of it shrinks kind of around the tooth as it cools. We have patients get in a hot shower and rinse their mouth with it and take it out in the shower because we like it to be that tight. And again, the turning you were doing there, a 1/4 millimeter with each turn. Patient can do that at home. Nice oral appliance for patients with obstructive sleep apnea, and something that gets approved by medical insurance all the time. This is a Dorsal Appliance, and as you put those two pieces together, it looks like Dracula. Looks like something from a Twilight movie.
It certainly does. Yeah, you like the way that looks?
And as you put those together, again, it's the same thing. We're moving the mandible forward. A lot of space in the front, though. As you open it up, you can see for the tongue. But if you try to go side to side, not a lot of movement there. So this is a good one for a side sleeper. They can't get very far when they try to do that.
And it's smooth without a lot of hardware.
Very, very smooth. The hardware is all contained in here. The only issue, as you might guess, is because we have a bilateral adjustment here. If the patient loses count and gets them off, exactly. Now we've got an asymmetric mandible. That's going to be crazy. Look at this appliance. That's the Oasis. This is the only appliance that's been reviewed by the dental and the ENT divisions of the FDA. So it's actually been approved for snoring, for obstructive sleep apnea, and nasal resistance. So you'll notice these nasal dilators. It's like a built-in breathe right strip. And so it goes in underneath here and literally dilates the nose. So if there's an obstruction there because of a polyp or something else, it will move that as well. We've got some tongue training tabs on there as well, and so that again appears to be a mouthful, but this is the only one that really kind of takes into consideration the fact that we might have some nasal obstruction, and that's what makes it a nice one to do.
A little different.
This is one that I'm familiar with because it's from Glidewell Labs. This is the Silent Night with the new slide link connectors on here.
It's been very popular.
It's been very popular because, again, it's a low-profile one. There's not a lot of hardware there. It's an easy appliance to put into place. It's got a hard outer layer, soft inner layer, so it's very comfortable. I know some people who, when they're going to put a patient in something, maybe like a Herbst, they will start them in this just to get them kind of used to wearing an appliance and seeing what it feels like to have something in their mouth. This is a full breath appliance. This is from Space Maintainer Laboratories down in Southern California. And this is the only one, as you notice all of these, this is the only one you'll see that's FDA approved for treating obstructive sleep apnea. That's a single arch appliance. All these other ones, upper and lower, mouthful. This one just is on the lower, and then you add some acrylic here. I think you've been playing with these a little around here.
We've been evaluating it in CR with good success, and I'll report on it in a few minutes when we're finished with this overall view. This one obviously pushes the tongue down, but you have to keep adding. We'll talk about it a little later.
Right. So not necessarily a great appliance for gaggers necessarily. I do want to point out one thing, though. Space Maintainers has done a great job and put together a laminated chart that really has, well, it has all the appliances they do, but they do an awful lot of them. And it's really nice of them to go through and do this. As you know, we get 0 hours of education in dental school when it comes to this. And so the labs that get into these types of appliances, they really have to do a lot of work to kind of bring the dentists up to speed.
They do.
This is another one from Space Maintainers, the Sleepwell appliance. Good entry-level device. You can see the mandibular advancements actually done by a little insert that slides in there on the maxillary. And so it's got differing levels of bringing the mandible forward. And again, it's pretty simple. It looks like an ortho retainer essentially on the top, and it looks like a thick, Essex retainer on the lower. And so really, that's pretty minimal to put in somebody's mouth and have them hopefully be able to adapt well to it.
This is an exciting one.
This is the newest and latest and greatest from Great Lakes Orthodontics, another company who's dedicated to making orthodontic and obstructive sleep apnea appliances. And they do a great job with education, too, if you go on their website. Lots of good videos. This is the Narval. It's a CAD-CAM appliance. Look at that. This material is so strong and fantastic.
Yeah.
Almost all these other ones will pick up stains and smells, and this one will not. It's printed from a CAD-CAM process. It fits so tightly that they don't even have to contact the anterior teeth. So on most of these, as you can imagine, when you pull that mandible forward and it wants to go, and it's pulling back like this, it wants to retrocline the maxillary incisors and procline the mandibular ones, and that doesn't happen on the Narval because of the fact that it doesn't contact the anterior teeth on the upper or the lower.
Are you confused? These are, as Micah said previously, I could make a car analogy, Fords, Chevys, and similar cars. They all do the same thing except this one, which holds the tongue down. We'll discuss maybe that is an alternative for someone who cannot have the mandible move forward without some side effect in the temporomandibular joint. Well, this has been an excellent overall view of how many, we were talking the other day, how many do you think there are overall internationally?
There's 100. I could watch that forever. Gordon and I on DVD together. It's like, for me, like I said, it's a dream come true, and I should just put that on constant loop in my office upstairs.
That
just
wouldn't be
always playing. Or maybe at the front desk of the lab. Nothing but that, constantly playing. Did you learn anything?
I did. I learned a lot, and I'm even more grateful now for the science because it really has improved my husband's life and then mine as well.
Exactly, and now that you see there's 15 different appliances we can make for him as well. We started with what we consider to be the most comfortable one, the Silent Night, but it's certainly not the more robust. Some of those other ones you could drive a tank over. And so if he breaks his or the dog continues to chew through it, we might have to go something more substantial where if the dog tries to chew on it, it'll break all your little puppy's teeth out. All right, that'll about wrap it up for this episode, this very special episode of Chairside Live. On behalf of myself, Megan, Dr. Gordon Christensen, the CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time.